those, one or the other. It's a professional brand company, so it's only sold through certain places. Yeah, pharmacies, health food stores, they won't be carrying them. All right, so gross motor. Delayed gross motor. So this is my theory. There is definitely a genetic component with Down syndrome and delayed gross motor. Part of my theory is that because the digestive system and the immune system is not fully mature, what happens with kids with Downs is that, yes, there is that genetic component, but because their digestive system is not mature, they are not able to absorb or fully integrate proteins and granules into their connective tissue, so into their muscles, into their bones. And that could be one of the main reasons why they do have this atonia, hypotonia. So nutrition, I'll start with nutrition, is for me very important to make sure that this kid, and starting from infancy, making sure that mom's diet is high in calcium, mom's diet is good in terms of how much protein she's taking and what type of protein she's consuming. And also mom's diet is also good with magnesium. These are the building blocks for bone. These are the building blocks for connective tissue. And vitamin C is also important too for connective tissue. Yep.
Is the digestive system in all children not mature, or is it specific to?
No, in all children, just like the immune system doesn't develop.
And again, what age?
That's about 7 or 8 for the digestive system. And I think also with the kids with Down syndrome, what happens is the moms are encouraged not to breastfeed. I don't know if you guys have experienced that in the hospital or not, but okay, that's good. Because
it wasn't so much you're not encouraged, it's you will have difficulty because they have Down syndrome. So that if you hear that right off the top, I was a public health nurse for years, and that was kind of the more or less never discouraged, but you will have additional challenges perhaps.
Okay.
The assumptions there, and that given everything else may be something they won't pursue because they have a lot of other things at the time to deal with.
Mm-hmm.
But that's kind of where it was presented to me too.
On is a real problem too, so it can discourage from it.
Yeah.
This is a low tone.
Because of the low tone. My experience personally, and also my experience with my clients, is that right off the bat, they basically were told this child has Down syndrome, you might as well give them a bottle. And so that's been my experience. So when you start off with that, you're not giving them the building blocks. The formula does have all of these nutrients in it, but it's not going to be in the same absorbable form as it would be from breast milk. So I'm glad most of us did not have that experience.
Well, you have to consider cardiac issues too.
Oh, definitely.
Because if they have a cardiac issue, breastfeeding is like running a marathon.
Yes.
So,
Yeah.
that's why some of the children or parents are discouraged because of cardiac issue. But there's also pumping and feeding.
Yes, and a lot of my clients have done that, is pumping and feeding. I have one client whose grandmother finger fed her. So just finger feeding the breast milk to the kid, which is pretty amazing. So half an hour, change, go back on and start finger feeding again. So those things, remember the calcium, magnesium, okay, and the protein, because we're going to come, when we get to the genes, we'll be talking a bit more about that. So the treatment is developing core strength with the digestion. Nick's hungry.
Always talk about
All right, you're going to share that, right? Okay, so we want to develop core strength. We want to develop core strength. This is going to help out with the digestion, especially with the constipation. So as long as we have that clean diet, then we want to work with core strength. So core strength for me means working with the abdominal muscles, right? How many of us have done Pilates? Okay, a few of us. So we know what core means, right? Medic, I found, it's a physiotherapy type exercise. Medic really, has anybody used Medic or physiotherapists that do Medic? Okay. What has been your experience with using Medic?
Depends on the therapist.
It does depend on the therapist, you're right. If you got a good therapist,
You have to define good. One of the therapists I worked with, we had a personality clash and a difference of philosophy.
okay.
And the other one I got along very well.
Okay. Well, you have to have that. You have to have that connection with your therapist. So Medic, so it doesn't seem like too many of us know what this is. So this is more in the earlier stages of life, when the child is learning to sit up, learning to crawl, learning to walk. So Medic, what the therapists do is they actually teach you how to roll your child out, how to help them to strengthen the obliques, the abdominal muscles, and then how to get them to a crawling position, how to actually teach them how to crawl, and then how to get them to stand up, and then teach them how to walk. So developing this, so every time you move, you're massaging your abdomen, right? You're massaging your colon, your large intestines, and that is actually how things get moving. That's how you're going to start moving your bowels. So if you're very sedentary, you're not going to move your bowels. So we need to get kids, and as if we have problems with constipation, we need to get moving, especially in the abdomen area. So nutritional support, what we want to do is make sure we have adequate protein, make sure we have good quality protein too. If we're doing animal protein, lean protein, vary it up. Don't have the same animal every day. Calcium, we want to have about 800 milligrams. And if we're going vegetarian, I do have sources of calcium sources, so that's the next slide. And the calcium ideally should be absorbable. So I personally don't like doing calcium supplementation because it's not in the best absorbable formulation. I'd rather people get calcium from the food that they're consuming. And then we also need to make sure that we have good fats. So good fats, and I'm talking specifically of essential fatty acids. I think most of us know about EPA and DHA. Yes? Okay, some of us. So EPA is, EPA and DHA are long-chain fatty acids, and they are needed for the development of brain function and also to help with decreasing inflammatory reactions, so decreasing inflammation in the body. And what I mean by good fats, we want to make sure that we have good sources of EPA and DHA to help nerve and muscle function. Because if you don't have the fats, you don't have the communication. If you don't have the fats, your cells are not able to communicate with each other. The nerve is not, brain, nerve, cell, there's no communication going on. So you need to have that. So some sources, the best source of EPA and DHA, and that actually is something that I do supplement with, because we don't get adequate amounts of EPA and DHA through diet alone, especially in the amounts that we do want. So just some, like in terms of calcium, what we need. So some of us are dairy free. So if we go away from dairy, we can still have, for instance, tofu has 150 grams of tofu will have almost 350 milligrams of calcium, and that's going to be in an absorbable form. You scroll down to tahini, 2 tablespoons. So tahini is sesame seed butter. It's not a lot. Will give you 130 milligrams. So if we can always mix and match this too, to try to get at about that 800 milligrams that we want for our children. And you do have it in your handout, but it's a really small form. So digestion is.
You're saying 800 milligrams for children. What would you recommend for an adult?
Adult would be anywhere from 1,200. Ideally, 1,000 to 1,200, unless if there's issues with osteoporosis, in which case you're going up to 1,500 or 1,800.
Can I just ask
in which case you probably will have to do some supplements at that time.
Just kind of like your lived experience of this dieting, your kind of like how you, like just some strategies for us. Like I went out and I bought the Vitamix and I'm buying things for Will, trying to get these foods into him because he is the picky eater. He has, very strong fruit preferences, and then trying to incorporate a more variety in the diet and these great sources of calcium and things. But just we have a lot of stumbling blocks along there, a lot of patterns that we're trying to change, even gradually, but we don't make a lot of progress when it comes to the diet.
What we do is we have a set menu for the week. And when we first started with the set menu, it was each person in the family picked what kind of food they liked, and that was their day. So, for instance, my older son loves Asian Chinese food. So on Wednesday, that's his day. So everybody has to eat the same thing. So because I'm lazy, I'm not making 5 different meals.
Right.
We it's all varied up. And so, for instance, Mondays is Mexican night. So we've got the legumes plus the cheese, and then there's always vegetable associated with it. Tuesday's usually Indian. So we're vegetarian, so there's legumes, there's vegetables, typically brown rice associated with that. And then stir fry, tons of vegetables, and tofu, some noodles. Thursdays I'm not home, so it's their junk night, so they do pizza on Thursdays. And then Friday, and then the weekend is free. But everybody picks a meal that they like to eat, and that's how it goes. And then you also have that variety too.
Right.
A lot of positive reinforcement, and my husband's really good with that in terms of motivating Jay to eat different types of foods. Stickers work well, computer time works well, iPad time works well.
Imitation. Our son tends to eat, like if his friends are around and they're eating it, then he thinks this is good, right?
So we normally have his friends over for dinner. On Thursday nights. But that's pizza, everybody likes pizza.
For the younger child, the 17-month-old child is tactile sensitive to food. A couple other things, texture, and touch problems.
Yeah. We keep it to the same type of, I would still use the base of what you're eating and keep it to the texture that he or she likes. And then
She's really bad. She gags. She's somebody she just ate a few years ago.
then you might want to consider going, like if you're not doing the calcium, maybe the magnesium might be better for her to have, because that'll help decrease some of that gagging reflex.
Oh, really?
And then, you can try that, and then possibly a homeopathic might also be helpful too.
Just a quick question. When you're talking about supplements, I have a daughter who can't swallow pills. So I've noticed some of these vitamins are big and bulky.
No, they come in powder. Everything that
they do.
come in powder.
Okay,
and
so you could mix it or do it that way.
Yeah.
Okay,
yeah.
great.
I'm talking about the little kids.
Yeah.
So the vitamin C comes in powder. Zinc comes in a liquid.
Okay.
Vitamin A comes in a liquid too.
Great.
Yeah, and magnesium comes in liquid.
I found that there's a lot of chewables out there because
Yes.
for adults, because the older population is having problems with pills as well.
Yeah.
So
Yeah.
they have a lot of chewables.
Okay.
The only thing with the chewable stuff is that there's going to be additives, right?
Sugar
And there's
and
also flavoring and sugar associated with it too. But the vitamin, all of this, even vitamin D comes, well, we all know vitamin D comes in a liquid form. And you can always throw it into yogurt or applesauce or juice or anything like that for them to drink. So they don't even have to see that it's there.
Okay.
Okay. Right. With the digestion, if there's been abdominal surgeries, then it's going to be a bit of a delay. Just like with the cardiac individual, there's going to be delays with digestion too. So we got to take it as their cue permits us to. And I think what Ravi said about the picky eater, like Jay was a little bit of a picky eater, the imitation, like having his best friends, he would not touch a burger. And we had a pool party, and one of his best friends was eating a burger, and it's like, okay, I'm eating this. So he mimics everybody. And if it's positive environment for him, then he'll eat it. Sorry? Okay, I thought I heard. Okay. So in terms of constipation, the movement is very important, but a few other things are also important. So water, I think most of us should know this, right? Water, for the little one, we want about 1 to 2 liters, depending on the age again. Most kids, and it goes across the general population, do not like to drink water. So if you start off really young, just sips of water here and there, and we've got an ironclad ship here. You got to drink it. You drink water, and then you can have X, Y, Z. But it's just something that you need to do. Fiber. Fiber, I'm not talking fiber as in a supplement form, but fiber as in fruits and vegetables, legumes. The softer the stool, loaded with the fiber, the easier it's going to be to pass out. With the kids with Down syndrome, they do have, because of the hypotonia, they may have a little bit of a larger bowel movement. So adding in magnesium for the constipated kid is not going to do it. You actually need to add in some calcium because we want the contractions. We want things to move along. So magnesium will, if they have hard stools, then magnesium will work. But if their stools are large and bulky, I know this is gross, but the calcium does help out.
How much calcium? The 1,200 for an adult and child?
Well, I'm talking, like for the kids, you want about, even 400 might be sufficient. You don't need to get into, okay, so about 1,000 too.
Yeah, I thought you had said that it was better to get the calcium through the food because
Yes.
it absorbs better.
Yep.
So now we're saying take calcium supplements?
No, I'm saying make sure that you have that much calcium through the food for the constipated individual. Or you might want to go, if the stool is hard and you're trying to get that 800 milligrams, you might want to take it up to say 900 or 1,000 milligrams through food. Okay? Ruling out food sensitivities will also help out. So if your child is constipated or you are constipated, the first thing I would do would be to take a look at your diet, see what you're eating. Are you eating something on a daily basis? Dairy, for instance, can be constipating, especially cheese, and I'm sure some of us already have that experience. And for some people, breads can also be constipating. So potentially removing those two things can potentially help out with the bowel movements and constipation.
So we shouldn't get his calcium from milk.
But there is so much more. Ask me for the list. Probiotics, we talk about probiotics, but probiotics, especially if there's constipation, there's going to be an imbalance in the gut flora. Especially if they've had a whole ton of antibiotics, there's going to be an imbalance in the gut flora. So you want to make sure that you want to add, and this is where you get supplements, this is where you will supplement, you want to supplement with probiotics. Yep.
After a course of antibiotics, how long do you suggest to be on probiotics?
I usually do probiotics along with the antibiotics, okay, but on opposite times of the day. And then we'll do probiotics for at least 2 weeks, depending on how long the course of the antibiotics was.
What's the difference between probiotics and prebiotics?
Prebiotic is the food that the probiotic eats. Yeah. So some people actually aggravate with the prebiotic. With some people, they actually get bloated when they have prebiotics. So that may not be the right thing to be doing, especially if there's a big abnormality, imbalance with the gut flora. Yep.
Can you do, or we have been doing, the probiotics and the cod liver oil on a daily basis?
Yes.
Antibiotics?
Yes.
That's
I think
okay and safe.
that's fine. That's fine. I think the cod liver oil is something that really should be across the board every day for our kids. Okay.
The probiotics is only necessary to get them on antibiotics for a while?
It's not going to do your child any harm if you do the probiotics, especially if they have that constipation issue. It's not going to do them any harm. But definitely you want to be giving them the probiotics when they're having antibiotics.
How much cod liver oil?
It depends. So for the little one, so say from 10 and younger, you can do anywhere from, well, really, really little guys, I would do about 500 milligrams. But above that 10-year-old, 4 to 10-year-old, I would do about 1,000 milligrams, 1,000 to 1,500
My
milligrams.
son is 16.
So I would probably go about 2,000, 3,000 for him. It's a lot of cod liver oil. So you have to actually take a look at the bottle and see what the dosage is. Yep.
Sorry, I missed the part. My cod liver oil?
Oh, it doesn't have to be cod liver oil.
Oh, okay.
It does, sorry, my mistake. It doesn't have to be cod liver oil, but it has to be some form of essential fatty acid.
Okay.
Okay.
Would
So you
the
can do
dosage
salmon or
be
anchovy.
different for a different oil?
Sorry?
Would the dosage be different
No.
for a different oil?
No,
Okay.
I am just talking about the essential fatty acids. So the combination of the EPA and the DHA,
Okay.
you want about, for the 4 to 10-year-old, you want between 1,000 to 1,500.
Went older than that before.
So, so 16-year-old, we talked about 2,000, 3,000.
Okay.
Okay.
What about just plain cod liver or plain olive oil or anything?
That's omega 9. It's not omega 3. EPA and DHA are omega 3. So olive oil is great. Cook with it. Use it. And it is also good for that cell-to-cell communication. But in terms of brain development, you need the DHA. Okay.
The DHA only needs to be high as an infant, right? Then
Yes.
as an adult, it's
Then
lower.
you need more EPA. Because that's when we start getting, as we get older, we also end up getting more information. So we need to increase the EPA. Unless if you have issues with brain function.
Which we all have.
Can't remember. All right, so what do you want to do when you go to your doctor? So when you have your annual hopefully, or biannual meeting with your NP, insist that you get regular blood work done. You want to get regular blood work done for the general population, but for your child with Down syndrome, this is the stuff that you want. So you want a CBC, you want to have ferritin. Ferritin is the iron storage. You want to know what the serum B12 is. That serum B12 and ferritin and CBC, really what they're checking for is anemia. So for instance, if your child is fatigued, not eating well, there may be an issue with anemia. If they're tired, easily tired, if they have poor concentration, it may be an iron thing or a B12 thing. So a simple blood test will tell you this. Serum homocysteine more with the older population, so not with the little guy. ESR, occasionally, I don't think your medical doctor will check ESR all the time. Homocysteine is a marker of inflammation in the body, and it's really specific for the X chromosome for 21. So a few slides later, we'll talk about that. ESR is a general inflammatory marker, so just tell you how much inflammation is going on, and then TSH is your thyroid thyroid stimulating hormone, so it tells you what your thyroid, how your thyroid is doing. At some point in your child's life, you want to assess for celiac antibodies. There is a big correlation with people with Down syndrome and also celiac. So the tissue transglutamase antibody and the nuclear antibody and total IgA are markers of celiac.
Just once in your lifetime for celiac?
Unless if you're suspecting that there's some issues going on, but a few times in your lifetime, your doctor's not going to do this annually, and I don't even think OHIP will do
No,
it
they don't.
annually.
There's a charge.
Yeah.
It's like
We were just
$100.
in the session before this, and they were saying at age 2, puberty and
So transitions.
menopause.
Okay, menopause,
Yeah, or
pre, okay, yep.
Yeah, because you can have false negatives. Like my daughter had a negative test at about 2 or 3, and then just recently she had a positive test.
Okay.
So,
And the thing is, when you're checking for celiac, you actually have to bombard the individual with food, with bread, with wheat. Because if you're, I don't know if you had her off of wheat
no,
when
what
you did the
happened was
first test?
she got really, really sick, and she had diarrhea. This is for like 2 weeks. In between, and we gone to the doctor in between, and then the doctor said, you know what, let's check her again for celiac, and it came back positive.
Okay.
So we never did do a biopsy.
Yeah,
Because I
that's-
didn't feel like it was necessary.
Especially if you got a positive.
Yeah.
Yeah.
And within 2 months, she's gained 2.5 pounds, which is a lot, because she's very small. So
Okay,
it was, because she's a different kid.
good, good. Glad it was found.
Yes, thank God.
Yeah.
But, you know, you feel like, you feel really inadequate as parents sometimes because it should have been caught, I felt like, earlier, you know what I mean? Because there were other signs that, and then you have, you know, the likelihood or the high percentage of celiac in children with Down syndrome. So, you know, there's always that guilt. That
Yeah, aren't we
should
good
have
at
caught
that?
early. Same with the thyroid, you talk about later, like, it's like all this guilt that you have when they finally discover things. So,
Yeah. Yeah, we're our best critics, aren't we?
It's true.
Yeah. So you know what, think about all the good stuff you've done for your child, rather than what hasn't been, what hadn't been found. So for the celiac antibodies at major stages in an individual's life, transitions. Yep.
And if you don't have the celiac, can you still have the sensitivity to wheat and
Yes.
have issues?
Yes.
So
Yeah.
it's a lot harder to figure out?
No, it doesn't have to be a lot harder to figure out. Like celiac just means, you know what, in terms of funding from the government, if you have been diagnosed with celiac, then you can use, you can get reimbursed for the gluten-free breads and all that stuff. If you are not diagnosed with celiac, but you're still gluten sensitive, because it's like autism, right? It's a spectrum. So gluten sensitivity, celiac is a spectrum. You may not be frank celiac, but you may, when you have some kind of gluten, you may feel bloated or have diarrhea, mental fogginess. You may even get cramping, but then you go and do the blood test, it shows up as nothing.
And if you've done the wheat-free and all that for a while, and you really haven't been able to pinpoint anything, does it mean you're okay? And that you don't have
Introduce it back.
Yeah.
So do the wheat free for about 3 weeks.